teacher and classmates. Today I would like to present about the profession of an emergency doctor, a job that plays an important role in hospital and is always associated with urgent and high-pressure situations. This is also a profession with deep human experience, meaning as it helps and saves people in the most dangerous moment of their life. Emergency department doctors play a very important role in hospital. They are responsible for receiving and caring for patients in sudden and critical situations, regardless of age or background. Their work is to provide emergency care and resuscitation and to stabilize patients during the acute state before transferring them to specialized treatment. I chose the career of emergency doctor because it allows me to help patients and save lives. When someone has an accident or fall into a critical condition, emergency doctor must be present in time to help them get through the most dangerous moment. I understand that this profession requires high professional expertise, long-term study, and the ability to work under great pressure. However, in return, it brings the trust of patient and meaningful value to society. That is what motivates me to pursue a career as an emergency doctor.
Emergency doctors use many basic medical tools every day. These include gloves, masks, stethoscope, and vital sign monitor, such as blood pressure and SpO2 monitor. They also often use syringes, IV lens, emergency medication, and airway equipment like the ampoule pack. Besides daily equipment, some medical devices are used less often, but are very important in critical cases. For example, defibrillator, spinal immobilization device, gesture, and emergency ultrasound machine have diagnosed and treated severe. Working in the emergency department is extremely demanding. Because of this working condition, emergency doctors face many challenges. They often experience high pressure, stress, and burnout. They are also exposed in infection risks and pressure from patient families.
Emergency doctors work in a very high pressure environment. They need to stay calm in a chaotic situation and make quiet decisions to save lives. This job also requires to have foresight and kindness to understand the patient pain. Become a doctor, you must study for 6 years in the university and 18 months of practice in the high school. You should focus on subjects like math, James, biology, or English. To the medical school, you will learn about the human body and life-saving skills like CPR. Nowadays, many top medical schools prefer students with an IELTS score of 6.5 or higher. English is very important because it helps doctors reach international medical book and talk to foreign patients. With good English, doctors can work better in a modern world.
1. Educational pathway. Stage 1. University education. Study general medicine 6 years. Pathway. Fundamental medical knowledge and complete license rotation at hospital. Stage 2. Emergency medicine rotation. After reduction to emergency medicine critical care at a specialty. Training pathway include emergency medicine residency specialist level 1 and emergency medicine upper 2 years. Specialist level 2 also after completing level 1. Stage 3. Advanced training and continue update. Continue medical education, regular update on emergency care, protocol, critical care, and disaster medicine. 2. Car part after reduction. Emergency department physician at hospital, critical care, emergency physician, re-hospital, emergency care, physician, disaster and mass casualty, emergency response, teaching and reserve in emergency medicine, enrollment as rivers or international hospital or working abroad. 3. Career progress. Very high demand, chronic shortage of qualified personnel, stable to relatively high income, a demanding profession but daily meaningful and impactful.
Main step in receiving and treating emergency patient. Reception and triage. Do not receive the patient and write down basic information. Name a reason for coming. Vital sign or check immediately. Pulse, blood, resort, reading rate, SpO2. If there is any problem, treatment and giving at once. Patient are classified by color to decide priority. Red, very dangerous. Yellow, need urgent care. Green, mild condition. Black, if the patient is sent to correct area. Initial assessment and for treatment. A, B, C, D, E. A, airway, check if the airway is open and clear. B, breathing, check breathing and give oxygen if need. C, circulation, stop bleeding, set up an IV line, check the pulse. D, disability, wiki check consonant and people. E, exposure, remote to look for other injuries. Principle, treat the more severe patient first, not for harm, for safety.
Frontline medical leadership among the first responders that's the surrender. Rapid line assess scale of the incident, number and severity of casualties. Ongoing risk. Coordinate with police, fire and rescue team. Emergency vision, set and foundation for the action. Medical response, triage and life-saving prioritization. Perform rapid triage to maximize survival. Identify patient requiring immediate intervention, delay treatment, palliative care, ensure efficient use of limited medical resources, correct GI decisions, save the greatest number of lives. Immediate emergency care on site provides critical life-saving intervention, airway management, hormone control,
cardiopulmonary resuscitation, trauma stabilization, reduce early mortality before hospital transfer, time like on-site care is vital to survival.